Sex can be redefined, as I say, to include many other things: kissing, touching, oral sex, toys, kink, whatever it is. It does not have to include pain. I want you all to understand that painful sex is not the norm. Today, I want to revisit the topic of painful sex specifically for women today. The medical term for painful sex is dyspareunia. Dyspareunia just is the global term for any kind of pain with sex. So it could be pain with penetration, even with a tampon. It can be positional pain, that when you're having intercourse or certain positions cause pain. It can be pain when there's deep penetration, but not necessarily at the entry. Painful sex could include pain after sex or at certain times, like different points in your cycle, for example. And it actually affects 75% of women at some point in life. And I know that I have had it when I started to go through menopause, particularly with vaginal dryness. I would really get burning with it. Now, that brings me to the causes of painful sex. So the first one I'm going to address, which is the hormonal changes. Now, hormonal changes that will affect whether or not you may have painful sex are not just limited to hormonal changes of menopause, because when you have a baby and when you're breastfeeding, your hormones change as well. So hormonal changes can definitely affect your enjoyment of sex and can cause pain. Pelvic floor dysfunction is something that can definitely cause painful sex. Tight pelvis. I'll address it a little more detail in a minute, but that is definitely a huge issue, and especially for a lot of women, the pelvic floor can be very weak after children or even just over time as we age. The blanket term of genitourinary syndrome of menopause. So hormonal changes related to menopause, specific things that may result, like dry vagina and other issues that could be a result of menopause, prolapse, things that could happen in the vulva and vagina. The shrinking or thinning of vaginal tissues is one of those symptoms under genitourinary syndrome of menopause. You could get a pinched nerve. There's a nerve called the pudendal nerve that goes down there. And I will tell you, I have had muscle spasms from that area after orgasm occasionally when I got pinched nerves down there. So I have all kinds of back issues, and it can be related. Bladder problems, chronic UTIs, that can definitely result in painful sex. Vaginismus, which is a term for involuntary spasms of the vaginal muscles. So if your vagina or your vaginal muscles are tensing up, it can be very painful. There's actually, you can get dermatitis in the vulva area or the vagina, skin issues. STIs, if you have herpes or genital warts, things like that can also cause pain. Ovarian cysts can sometimes increase pain when you are having penetrative sex, and then endometriosis. Now, some of these issues are definitely things you want to address with a licensed medical provider. So I'm just going to give you my understanding of them, but they are things that you can be experiencing, and they are you don't need to live with them. They may be, they're not normal in that you should not be having painful sex, because if sex is painful, you're not going to want to have it. You should definitely not be enduring it, because women are often, we feel like we need to endure. It's sort of the same reason often doctors who are still living in the past don't recommend hormone therapy, because we should be enduring the pain. I will say for the females out there, you do not want to live with pain, particularly painful sex. It's not necessary. So what are some of the reasons you might be having painful sex? We need to be aroused at a certain level to get lubricated enough. When a woman is aroused, she will get lubricated most of the time, and sometimes that requires a little help as well. The vagina widens and the cervix moves out of the way, so that will make it more comfortable for penetration. If you do not have adequate foreplay, whatever it is, to get lubricated, then it could be very painful to be penetrated. you want to think about, and I would recommend this regardless of whether you're suffering from painful sex or not, add lube. Lube just makes everything that much more fun and slippery. Water-based lubes, I don't like them because you have to keep adding them, but some people prefer them. I like a silicone-based lube that really helps everything get a little more slippery. And he likes it too because it works with your hands. And then when he penetrates, you've got that lubrication already there. But I still say the foreplay and making sure that the woman is feeling, or that you're feeling comfortable having being penetrated, is really, really important to avoid penetrative sex. If your partner is particularly endowed, he's got a large penis, sometimes we talk about how that looks so great, but when it's actually trying to penetrate a rather small vaginal hole, it can be super, super painful, and especially long penis. I know I've had that experience, and it really hurts. There is something called, I'm sure there are a lot of tools out there. There's one called the O-nut, which basically limits how deep the penis can penetrate the vagina. So that might be helpful in the case of someone who is extremely long and is hurting you or hitting your cervix, or if deep penetration, it really hurts because of a large penis. In perimenopause, the vaginal tissues get thin and they shrink and they get dry, and that is caused by the lack of estrogen. Topical estrogen, which is perfectly safe according to medical experts, unless you have active breast cancer, and I will encourage you to research that more deeply, because it's actually not true that vaginal topical estrogen will give you cancer, and it's extremely safe and actually can help prevent UTIs, beyond just helping to prevent the thinning and keeping the tissue moist and comfortable so that you will not be feeling like sandpaper sex. Vaginal moisturizers are also helpful. Hyaluronic acid, there's one I've used. Again, I'm not sponsoring any of these products. Reverie from, I forget the name of the company now. They have it's like a suppository, and it's effectively putting a moisturizer. Bonafide is the name of the company. It's effectively putting a moisturizer in your vagina that like you would put a moisturizer on your face, only in this case, you're putting it inside your vagina. Now, pelvic floor issues, and I swear I've experienced many of these things. Luckily, none of them have been serious medical issues, but I have had pelvic floor issues. When your pelvic floor is really, really tight, a couple of things can happen. But mostly what I'm going to address today is that if your muscles are really tight and tense, when somebody tries to put something in there, it's going to hurt. And you need to learn to relax those muscles. Now, you can do that with a pelvic floor physical therapist, which that is becoming something that is a specialty of physical therapy. I have done that. It actually is helpful in relaxing the muscles and helping to relax the pelvic floor in general. Kegels are not the answer, okay? A lot of people talk about Kegels are actually you're tightening up, and they're specific to a certain muscle. So be very careful when somebody tells you you got pelvic floor issues, go do some Kegels. That can be counterproductive. It can actually make you more tight. And when your pelvis is really, really tight, it also can feel like you have to pee all the time. The other thing that has been helpful to me, I recently interviewed Dr. Soom Rakshit from Mystery Vibe. Mystery Vibe is a company that created a bunch of vibrators specifically for medical issues. And I'm not getting anything from them. I'm not sponsoring them. I use their product, the Crescendo 2, so I can tell you about it. And it goes inside and it has the vibration, kind of like the Theragun, and it helps relax the muscles. So sometimes, when I'm feeling extremely tight, when it feels like I have really, really, really tight hip flexor or lower abdomen, I will use that gently inside, and I can tell where the knots are and sort of get that out of, sort of loosen up that tissue or that muscle. If you have some sort of infection like an STI or even a yeast infection, that can make sex painful. It can feel like it's burning, definitely you want to see your medical provider and have them prescribe, whether it's the topical estrogen or some other kind of cream, or yeast infection. You can take an oral right now called Dysfunction or Monistat cream. I'm sure there are many other ones out there. All of those need Monistat, I believe, is over the counter, but Dysfunction needs a prescription. That's just for yeast infections. You could have any number of different infections that are easily cured with some sort of antibiotic or topical cream. And even sometimes when you have excessive burning that is not because of a yeast infection or isn't being helped by vaginal estrogen, there are creams that can kind of settle down an irritation. And then the last thing I'm going to talk about is sex therapy. And the reason I bring that up is that often when your body, whether it's because you've suffered some sort of sexual trauma, or simply that it is painful, and the trauma is that every time you get penetrated, you're so afraid of the pain that your muscles tense up. So you go to a physical therapist that specializes in pelvic floor dysfunction. They help you relax the muscles, but you're still having the problem because your brain is saying, "Oh no, something's coming. My vagina is going to tense up, and it's going to hurt. It's going to hurt." So sometimes some sort of therapy can help you train yourself to enjoy again and to be able to relax into the connection and the moment and enjoy penetrative sex. And then in some cases, penetration is just off the table because it just doesn't feel good. Whatever the medical issue is, whether you're in between, whether you're in between babies, or it's just something that you've tried every possible treatment. Sex does not have to include penetration, right? Sex can be redefined, as I say, to include many other things: kissing, touching, oral sex, toys, kink, whatever it is. It does not have to include pain. I want you all to understand that painful sex is not the norm. Pain is not something, unless you choose to have pain, you're into BDSM. That's a completely different story. But painful sex is something that you can overcome so you can enjoy sex, whether it's dealing with something medically, whether it's hormone therapy, whether a medical issue, antibiotics or topical creams, sex therapy, pelvic floor physical therapy. These are all options for you to have more enjoyable and less painful, in fact, painless sex.